I always knew that colon cancer was part of my family history. Both of my maternal grandparents had colon cancer, and my mom has had colon cancer 3 times.
Colorectal cancer is one of the leading causes of death from cancer, but screening is proven to decrease the risk.
My mom had always told us that we have to be an advocate for ourselves and get colonoscopies early, so I did start in my 30s.
Sara first came to see me several years ago now, and her concern was her family history. Should we be doing something different based on what her relatives had experienced?
Dr. Ladabaum said, we're going to get a plan for you, and it's going to be okay. It's about preventing colon cancer. Because of the family history that I have, I need to come in every year for a colonoscopy, where before it was 5 to 10 years. Dr. Ladabaum gave me hope that this is preventable.
People who do not have a family history of colon cancer may wonder, do I even need to think about this? I feel fine, I have no symptoms. And the answer is yes. Everyone needs to be thinking about this because there is some level of risk in the population that is substantial enough that we think that screening can make a difference.
Stanford makes it very easy to come here and have a colonoscopy. I always have someone calling me a week prior, a couple days prior, making sure I understand the prep, making sure what time I need to be there. When I get here, the check-in process is always so fast. The nurses and the staff are always so kind and compassionate.
What's unique is that the nurse who goes out to greet the patient is the same nurse who guides them through their whole visit. It really highlights the continuity of care. It allows us to build that relationship. I want my patients to go home and say, it wasn't that bad. That was a great experience. I don't know why I was so worried about it.
For some patients, a primary role is to be part of their screening team when they need a screening colonoscopy. There are other patients who require ongoing care, sometimes for decades, and we hope they view us as a partner and somebody who will be with them no matter what the future brings.
Colon cancer is completely preventable. Why not go and get a colonoscopy? I feel like I've taken control of what I can control.
It is a team. It's not one person, it's thousands of people. And when you have that level of care to answer not only Sara's questions, but my questions too on behalf of our family, big time blessing.
When I look at my kids or I look at my husband, I know exactly why I'm doing this every year. I'm doing it to prevent colon cancer.
Stanford Hospital is once again ranked one of the best hospitals in the nation by U.S. News & World Report. Discover more at stanfordhealthcarenow.org.